are a lot of unknowns about this new strain. Do we know at all how long it's going to take to know just how much of a threat it really is?
Well, as you've been saying, it's very hard to know right now, Jeannie. Just 3 or 4 days ago, no one had ever heard of the Omicron strain of the coronavirus. So information is coming out bit by bit as more is discovered. Anthony Fauci, the head of infectious diseases, that well-known character in the United States, he is saying that it's going to take at least 2 weeks, maybe more, up to 4 weeks, to have some kind of solid information about the risks of this new strain of the virus, and also to know whether or not it can be transmitted rapidly, just how dangerous it is, will antibodies block it, and what will be the efficiency of the vaccine that thousands, millions of people around the world have had or are getting at the moment. I think the bottom line here is that there's a great amount of uncertainty. So this is leading a lot of countries either to close their borders or to threaten to close their borders, as we've seen. As you've been saying, Israel's closed its borders, so has Japan, so has Morocco. Other countries are going to follow suit. And then you have, for example, South Africa, which is complaining that it was the country where this new strain was discovered, and they feel that they're being penalised and people should be allowed to fly into the country. And the World Health Organization has also said that it's not a good idea to block borders at the moment. Now, there has been a statement from the World Health Organization within the last hour or so, which is saying that this new variant has a very high number of spike proteins, so is more complicated to keep under control. It said it's posing a very high global risk and has urged all nations around the world to accelerate the vaccination process and the mitigation process to help fight against this virus. So a very serious state of affairs so far this Monday.
Concretely, Philip, what are the risks for those of us who are already vaccinated, and what can people do to stay safe?
Well, I think that the underlying feeling is that if you are already vaccinated, even though it's unclear whether or not this strain of the virus is going to be able to get round that vaccination. The fact that people have been vaccinated already for months and have been revaccinated, may even have had a booster shot, they have a very high amount of antibodies that will act as some kind of resistance to this strain, even if it is maybe less resistance than to the Delta variant, for example. So the emphasis is on get vaccinated while you can, do it as fast as you can, and that is the best way of defending yourself. Of course, many people can't get vaccinated, or there are not enough vaccines to go round. So the advice there is, well, we all know the measures that we have to take to protect ourselves. Wear a mask, open windows to aerate rooms where you have people gathering. There are other measures you can take. Keep social distancing from each other. Keep 1 meter distance. Don't kiss, don't hug people. And of course, another one which is very important is wash your hands, Jeannie. Keep your hands clean, wash your hands several times a day. That is one of the best ways of preventing the transmission of the COVID-19 virus, be it this new Omicron or the Delta variant. Those are the simple measures one can take to protect oneself in the build-up that more and more people are vaccinated around the world. And it's only when there is a greater amount of vaccination that's taken place, there will be this herd community that will eventually finish off the coronavirus. But unfortunately today, we're still a long way away from that.
Philip, thanks so much for that.